Good morning, everyone, and welcome to today's presentation. I'm Dr. S.K. Singh, holding a PhD, and I'm excited to be here with you. Today, we'll be exploring the topic of QMS in Pharma QC laboratory. This is a crucial aspect of ensuring quality and compliance in pharmaceutical testing. Over the course of this presentation, we'll cover what a quality management system is, why it's important in a QC laboratory, and how it can be effectively implemented. Let's get started and delve into this important subject together. Let's talk about responsibility within the quality management system. It's essential that management ensures all parts of the system are properly resourced. This means having competent personnel who are well-trained and capable of carrying out their roles effectively. It also involves providing suitable premises, equipment, and facilities that support our quality objectives. Now, a strong organizational structure is the backbone of this system. It clearly defines who is responsible for what, making sure everyone knows their roles. Responsibilities need to be well documented, so there's no confusion about who does what. Processes and procedures are equally important. Take the laboratory process flow, for example. Having clear, standardized procedures ensures consistency and quality in our work. And of course, resources, whether it's personnel, equipment, or facilities, must be adequate and appropriate for the tasks at hand. All of these elements, structure, responsibilities, processes, and resources, come together to form a robust quality management system that supports our overall goal of delivering quality and compliance. Let's now turn our attention to the crucial aspect of energy supply. It's essential to have a robust material procurement system in place to avoid stockouts, ensuring the laboratory always has what it needs to operate smoothly. Additionally, providing comprehensive support services helps maintain efficient workflows and quick problem resolution. Moving on to resources, we must ensure that all necessary resources are available not only for the day-to-day running of the laboratory, but also for maintenance. This includes having an adequate number of trained personnel, and importantly, trained deputies for specialized scientific staff, so operations can continue seamlessly even if key personnel are unavailable. Infrastructure is equally vital. We need to consider the size and layout of the facility, as well as essential facilities like water supply and waste disposal systems. Proper equipment, including analytical and safety tools, is fundamental to maintaining high standards and safety protocols. Finally, integrating a strong quality management system is key. It helps us consistently meet quality standards, improve processes, and ensure reliable results. All these elements, resources, infrastructure, and quality systems, are interconnected and essential for the overall success and sustainability of our laboratory operations. Let's take a closer look at the organization of our laboratory within the larger parent organization. It's important to understand how the structure is designed to support quality and efficiency. As you can see, the organizational chart clearly shows where the laboratory fits in the overall framework. A key point here is that each manufacturer should have its own quality control department. This department needs to be independent from production and other departments to maintain objectivity and integrity in quality assessments. Independence helps ensure unbiased results and strengthens our overall quality system. Now, focusing on responsibilities, the main roles fall to key personnel such as the quality control manager, supervisors, analysts, and support staff. Each of these roles has specific duties that contribute to our quality objectives. It's crucial that everyone understands their responsibilities and how their work impacts the overall management system. Personnel awareness is another critical aspect. Everyone in the team should be fully aware of their duties and how their contributions help meet our management system objectives. When staff understand their role in the bigger picture, it fosters a culture of quality and accountability. Finally, effective communication is vital. Top management should establish clear processes for communicating the effectiveness of the management system. Open and transparent communication ensures that everyone stays informed and engaged in continuous improvement efforts. All these elements, structure, independence, Clear responsibilities, awareness, and communication are interconnected and essential for maintaining a robust quality management system that supports our overall goals. Let's talk about personnel, which is a critical component of maintaining quality and reliability in our operations. First, it's essential to use competent staff, including contracted employees, to ensure we have the right skills and expertise. Supervising staff as necessary helps maintain oversight and quality control. Documenting qualifications and training is also vital. It creates a clear record of each team member's capabilities and development. Additionally, maintaining documented training programs allows us to evaluate the effectiveness of our training actions regularly, ensuring continuous improvement. Every personnel member should have a clear job description, outlining their roles and responsibilities. This clarity helps avoid confusion and ensures accountability. For specialized tasks like sampling, testing, issuing reports or certificates, and giving opinions, there must be special authorizations. These authorizations serve as a formal recognition that the personnel are qualified to perform these critical functions. Overall, competent, well-supervised staff with documented qualifications and proper authorization are the backbone of a robust quality assurance system. They help us meet our standards and deliver trustworthy results across all our activities. Let's talk about the competency of personnel. So, what do we mean by competency? Well, it encompasses three main areas: knowledge, skill, and personal attributes. Knowledge is about having a complete understanding of the methods we use. It's essential that personnel know the procedures thoroughly. Skills refer to the practical ability to carry out the analytical tests effectively. And personal attributes include qualities like attention to detail, responsibility, and a proactive attitude. Having complete knowledge of the method is crucial because it ensures that tests are conducted properly, leading to accurate and reliable results. But knowing isn't enough. One must also have the capability to apply that knowledge skillfully. That's why ongoing assessment is so important. Regularly scheduled evaluations of personnel competency help us identify areas for improvement and confirm that everyone maintains high standards. Ultimately, maintaining a competent team is key to the overall quality and integrity of our analytical processes, and it ties directly into our commitment to excellence in our work. Let's talk about document control. This is a system that ensures we're always using the most current documents and makes it easy to review and update them when needed. Good documentation practice really forms the foundation of a strong quality management system, or QMS. When creating a document, it's important to give it a unique identification and ensure it is approved by an authorized person before use. This helps maintain consistency and accountability. Distributing the document is the next step, and it can be done electronically or through hard copies, depending on what's most appropriate. We also need to identify who needs access to each document and maintain a distribution list to keep track of this. Now, documentation isn't just about creating files. It includes SOPs, work instructions, logs, and records, as well as reports and systems like the Laboratory Information Management System, or LIMS. A key aspect is data integrity, making sure the information remains accurate and trustworthy throughout its life cycle. This involves careful control over document creation, revision, review, distribution, and storage. Finally, it's essential to collect, review, and properly store records, and retain them for as long as necessary. All of these steps help us maintain control, ensure compliance, and support continuous improvement in our processes. Let's take a closer look at document control. This is a crucial part of maintaining our quality system. When we review documents, it's important that the same function that approved the document is also responsible for reviewing it later. This helps ensure consistency and accountability. We need to keep track of when a document is due for revision, which helps us stay current. Also, whenever there's a need for changes or updates, those must be addressed promptly. Once a change is made, staff members are notified, and any necessary review or training is provided to ensure everyone is on the same page. old documents are retrieved and replaced by the new, updated versions. This way, we avoid confusion and ensure only the most recent information is in use. Our master list of documents is updated to reflect these changes, giving us a clear overview of our documentation status. Moving on to documentation availability, authorized editions should always be accessible at the locations where they're needed, making sure the right document is in the right place. Any invalid or obsolete documents should be removed from active use to prevent errors. However, obsolete retained documents are marked clearly, so we know they are no longer current but are kept for record-keeping or reference. Finally, it's essential that we review and revise our procedures periodically. This ongoing process helps us improve and adapt our documentation to any new requirements or insights, maintaining the integrity of our quality management system. Now, let's talk about technical records. These are essential for maintaining a clear record of all the observations and data related to our processes. This includes original observations captured in worksheets or logbooks, as well as equipment logs that track the performance and maintenance of our tools. Test reports are part of these records too, providing documented evidence of our testing procedures and results. Chromatographs and spectra are also included. These are critical for analytical purposes, offering detailed insights into our samples. Printouts and sheets serve as tangible evidence of data generated during analysis. Additionally, certificates of analysis or calibration certificates are important to verify that our equipment and processes meet specified standards. Moving on to the control of these records, it's vital that our quality and technical records are both retrievable and traceable. This means we can easily locate any record when needed and understand its history. The retention time of records must be clearly defined, ensuring compliance with regulatory requirements. Proper storage and security measures are crucial to protect these records from loss, damage, or unauthorized access. For electronic records, we must have robust systems to back them up and ensure their safety. Overall, thorough documentation is the foundation for quality assurance and regulatory compliance, helping us demonstrate that our processes are consistent and reliable. Let's talk about the importance of following the SOP on good documentation practice at all times. This is crucial because accurate and reliable documentation underpins the integrity of our work. When recording data, always use permanent ink and write clearly so that your entries are easy to read. If you make a mistake, strike it out neatly with a single line. You want to keep the original record visible. Remember to make your entries at the time each action is taken, not afterward, to ensure accuracy and timeliness. Avoid using pencils or correction fluids like Tipp-Ex, as these can obscure the original data. Do not shorten signatures or use signatures that are not properly referenced, because this can lead to confusion or questions about authenticity. Also, do not tick off entries or leave any required space blank. Every part of the record must be complete and truthful. It's very important to never discard original data. Every piece of information must be preserved because it forms the basis of our traceability and accountability. Record all data thoroughly and completely. Nothing should be left out. Always sign and date your entries, which confirms your responsibility and the accuracy of the data. Finally, I cannot stress enough, never indulge in fraudulent practices. Integrity in documentation is fundamental to maintaining trust and compliance in our work. By following these principles, we uphold the quality and reliability of our documentation, which is essential for the success of our operations. Let's talk about documentation and what makes a good document. First, it should be simple, meaning the content needs to be clear so that anyone reading it can easily understand the information. Next, it should be orderly, which helps make the document easy to follow and check, ensuring that the information flows logically. It's also crucial that the document is clear and legible, so photocopies are sharp and handwriting is easy to read. For interactive documents, there should be sufficient space for data entry, allowing users to add their information comfortably. Additionally, a good document must be up to date, meaning any amendments are approved, signed, and dated to keep everything current and reliable. When we think about attributes of a good document, It should be free from errors, ensuring accuracy and professionalism. By focusing on these key points, we make sure our documentation supports effective communication and smooth workflow, which ties directly into the overall theme of maintaining quality and consistency in our processes. Now, let's discuss some essential safety measures in the laboratory. First and foremost, preventive maintenance and regular verification of instruments and equipment are crucial to ensure everything functions accurately and reliably. Sampling is another key point. Collecting representative samples properly is vital for valid results. Testing of samples involves specific methods and equipment, which we need to describe clearly to maintain consistency and accuracy. When we encounter atypical or out of specification, or OOS, results, it's important to investigate thoroughly to identify root causes and prevent recurrence. Validation of analytical procedures helps confirm that our methods are suitable for their intended purpose. Keeping the laboratory clean is also fundamental. This includes cleaning workbenches, equipment, workstations, clean rooms, and glassware to prevent contamination. Monitoring environmental and storage conditions ensures that samples and materials remain stable and uncontaminated throughout the process. Hygiene practices among personnel play a critical role in maintaining the integrity of our work. Handling of reference substances and materials must be done carefully, with proper storage, labeling, and quarantine procedures to prevent mix-ups and ensure traceability. Equipment qualification and calibration are ongoing processes to maintain measurement accuracy. Waste disposal must be performed responsibly to comply with safety and environmental regulations. All these activities should be guided by authorized written SOPs, standard operating procedures, that are regularly reviewed and updated. It's also important to control changes systematically, conduct internal audits and self-assessments, and handle any complaints promptly. Corrective and preventive actions are necessary when issues arise, and personnel training ensures everyone understands and follows these procedures. Validation and verification, along with qualification and calibration, are continuous efforts to uphold quality standards. Finally, thorough documentation is essential. We must have clear procedures in place to record all activities, ensuring traceability and compliance with regulatory requirements. Now let's discuss deviation control, which is a fundamental part of maintaining quality and safety in our processes. When a deviation occurs, we need to implement change control to manage it effectively. This involves investigating failures such as out of specification, OOS, or out of trend, OOT, results to understand what went wrong. Handling complaints is another critical aspect. These often point to underlying issues that need addressing. Conducting a thorough root cause analysis helps us identify the true source of the problem, rather than just treating the symptoms. Once we've identified the root cause, immediate actions are taken to contain or mitigate the issue. Following that, we develop corrective actions to fix the problem permanently, and preventive actions to prevent recurrence in the future. Market complaints are closely monitored because they can lead to product recalls if necessary. Managing these situations effectively is key to protecting both consumers and our brand reputation. Finally, occurrence management encompasses all these activities, tracking, investigating, and resolving deviations to continuously improve our processes. This comprehensive approach ensures we maintain high standards and comply with regulatory requirements. Let's talk about the importance of assessing our own processes, whether formally or informally. This step helps us identify potential risks and areas for improvement. We base these assessments on a thorough risk evaluation of our processes and SOPs. Once we've done that, we need to prioritize our schedule according to the risk level, high, medium, or low. This way, we focus our attention where it's needed most. It's worth noting that these assessments are more frequent than our internal audits, allowing us to catch issues early and maintain better control over our processes. After completing the assessment, we generate a report and forward it to the QA team for review. From there, we implement CAPA, corrective and preventive actions, to address any identified issues. Additionally, conducting self-inspections regularly is crucial. These practices together help us maintain a proactive approach to quality and compliance, which aligns with our overall goal of continuous improvement. As Philip Crosby once said, "It isn't what you find, it's what you do about what you find." And that's really the core message here. Continuous monitoring is essential for success in any quality system. It's about constantly keeping an eye on how well our processes are performing. Key performance indicators, or KPIs, help us measure the effectiveness of these processes. They give us concrete data to see where we're doing well and where improvements are needed. Regular audits are also crucial. They help verify that we're following procedures, standards, and other requirements laid out in our quality management system. When we identify gaps during these audits, it's important to address them promptly. Correcting issues quickly prevents small problems from becoming bigger ones later on. And then, we generate audit reports to document what's been found and what actions have been taken. All of this ties into process improvement, using the insights gained from monitoring and audits to make continuous enhancements. It's especially important in our laboratory QMS, where maintaining high standards directly impacts the quality of our work and results. So remember, monitoring isn't just about checking boxes. It's about actively improving our system based on what we discover. That's how we turn findings into real, meaningful action. Let's talk about the importance of maintaining a current and up-to-date collection of records used and generated in the laboratory. This is crucial for ensuring product traceability from receipt all the way to final disposal. Having accurate sample logs, proper labeling, and accompanying documents helps us track everything precisely. Next, safety procedures and measures are fundamental. We need to follow appropriate safety protocols to protect everyone in the lab. Providing adequate supervision of personnel is also key to maintaining a safe and compliant environment. Additionally, we must ensure that the necessary technical resources are always available. This supports the consistent quality of our operations. Clear communication and information flow between team members at all levels are vital for smooth and efficient processes. Now, it's essential that our analysis is conducted in strict compliance with Good Laboratory Practice, or GLP. Responsibilities for management and personnel should be clearly defined so everyone knows their roles. We also need to carry out analyses in a timely manner to meet our project deadlines. Finally, we must employ measures that strictly adhere to quality assurance standards for our test results. Implementing an effective quality management system, or QMS, in the laboratory is the backbone of ensuring consistent, reliable, and compliant operations. When we focus on these key principles, we reinforce the overall integrity and credibility of our lab work. Let's take a moment to understand the importance of making sure staff are aware of how their activities contribute to our management system's objectives. When everyone understands the relevance of their role, it enhances motivation and accountability. Training and competency assessments are scheduled regularly to ensure our team stays skilled and up to date. If any deviations from procedures occur, we investigate and document them thoroughly to understand what happened and prevent recurrence. We also implement appropriate corrective and preventive actions to address issues proactively. Our change control system is established, implemented, and continuously monitored to manage changes effectively and maintain system integrity. Management reviews of the QMS are a key part of this process. During these reviews, we assess whether our quality objectives and KPIs are being met. We also evaluate changes in work volume, regulatory requirements, and policies, both company and government, that might impact our operations. Additionally, we review personnel requirements to ensure the right people are in the right roles. The outcomes of these reviews create action plans that drive continuous improvement of the QMS. The ultimate goal is to ensure the effective implementation of the QMS in the laboratory. By doing so, we maintain high standards, adapt to changes, and continually improve our processes to deliver quality results. For further support, please don't hesitate to reach out. We're here to help you with any questions or additional information you might need. Feel free to contact us at any time. Thank you so much for your attention and engagement throughout this presentation. We truly appreciate your interest and look forward to assisting you further.